Hi guys, welcome back to Learn Your Body Thursdays. My name is Dr. Chris Sovey, and thank you so much for joining me again as we continue our journey up through the body. We started with the toe and we are working our way up through the body to help you learn more about how you can prevent joint injuries and how you can decrease the effects of the injuries or deterioration you might have in your joints already. Last week we looked at the structure of the hip. And we looked at how the structure of the hip and its great freedom of motion enables it to do many things, but also puts it at risk, higher risk for injury. I will tell you that this particular joint is of great importance to me personally because of my own injury that I had when I was in a snowboarding accident. And what's happened is I had a labral tear in that hip, and so I've really had to learn about the complexities of the hip. And if you're suffering from hip pain, I can literally say, I know how you feel. And it can be nagging. It can be just this ongoing thing that you do anything to get rid of. So I want to talk to you about some of the things that I've learned that you can implement immediately, and you can start feeling better. I will encourage you, if you've had any ongoing hip pain though, this is definitely something you want to have examined. If you haven't seen a physical therapist or a physiatrist, somebody that really understands how the hip works, I highly encourage you to do so because it's a complex joint and it's often overlooked the seriousness of some of the things that can be going on, and they could be treated conservatively if it's addressed early enough. And even if you have severe deterioration in your hip, I want to say this, guys, I can't tell you enough how many patients have come into me and they say, oh, well, doc says it's bone on bone, or they say that I'm absolutely going to need surgery. It is not my job to dispel that or to go against what surgeons say. But I will say, as a physical therapist and spends his entire life in rehab, I will tell you there are people walking around with significant deterioration in their joints, whether it's their hip or something else, and they're still doing okay. The key thing here is that we change some of the lifestyle things, we change our movement patterns, how we're moving, and we address some of the muscle imbalances that are going along with that. When we talked about the hip, we looked at how the hip is stabilized in all planes of motion. And one of the first things I want you to really start to explore with yourself, if you haven't already, is how you sit and how you walk and how you stand. Those three things. When we look at the pelvis, again, just a quick refresher, we want to make sure that both our butt cheeks have equal pressure on the surface that we're on. We don't want to be sitting over on one butt cheek because that creates problems. We also don't want to be rotated in our pelvis where one side is dropped back, and that can happen by crossing your legs, whether it's at your knee or your ankles. Feet firmly on the ground, just as I talked about in yesterday's video. So the other thing is that we don't want to be back here like this, where we're rounding out the spine for long periods of time, because that in itself will also create problems with the hip, because we are now creating pressure on the lumbar spine as well, and we're shortening all those muscles in the front, like your hip flexors, down the front of your leg there. Not a good place to be. So watch how you're sitting. Standing is similar. When we look at the model of the skeleton, when we're going all the way from our toes, we already established, right, that the foot and the ankle play a large role in the function of the hip. So we want to have, if we look in the side, like if we're looking at a mirror beside us, we should have a straight line all the way from the side bump ankle, the side of the ankle bump. I know you can't quite see that in the camera, but the little bump that sticks out on the side of your ankle, up through just the back of the knee, up through the side of the hip, that greater trochanter, that little bump you can feel if you push on the side of your hip, up through the pelvis, through the tip of the shoulder, and out through the ear and crown of the head. So that's really important. How you stand is critical to hip pain. Now, I had a comment on last week's video. Someone was saying, that oh, my PT had me do lunges, and after I talked about like not going right into lunges. I don't want you to think that lunges or complex motions are a bad thing. They certainly are not. It's just that we have to address some of the smaller components first. We have to make sure that you're breathing well. We have to make sure that the pelvic floor, the muscles at the base of the pelvis, are able to relax and contract enough to support the hip. So, when you're standing, we've got our feet firmly on the floor. Our weight is back on our heels, so we have that alignment that we just spoke of. We also want to make sure that, again, you are not standing way out on one hip. You're not cocking your hip out to the side like this or twisting the hip. Maybe you've got one knee bent and one knee straight, which is creating a pressure out on the outside of the hip. That's how a lot of people get bursitis. So weight bearing equally through both extremities is important. If you have a problem at your ankle or your foot, you need to address that concurrently with the hip. They need to be able to bend pretty equally, so you're able to have a leg length that is the same as well, and not wear down the knees. So if you've ever been told you've had a leg length discrepancy, I want you to keep in mind that there are two types of leg length discrepancies. The first is what is called a functional leg length discrepancy. A functional leg length discrepancy is where you have an alignment issue with maybe your pelvis or your knee or your foot, and it makes one leg look shorter than the other. So if someone goes and puts a lift in your shoe immediately, that might be the wrong approach, and it might actually make your hip or back or knee pain worse. I really hate to be the bearer of bad news here, guys, but if you're having hip problems related to a leg length discrepancy, make sure that they do a postural study where they're taking an x-ray carefully and they are aligning you properly in order to measure the true leg length discrepancy. Now, I'm not saying go out and have an x-ray right away if you've been told you have a leg length discrepancy. You need to have somebody assess that's knowledgeable in leg length discrepancies and can be able to spot the difference between a functional and a true leg length discrepancy. So make sure that your legs are equal, for one thing. If you're trying to prevent further deterioration of the joint, or you're trying to prevent injuries in general, you want to make sure our leg length is pretty close to, there may be a slight variation, but pretty close to the same length. That is a critical part of this. And then lastly, thinking about how you walk. We've talked about this in previous episodes as well, where there are two types of walking. The first type of walking are pullers. Pullers are those that will lift their legs in order to come forward, and then there are pushers who use their glutes. We talked about this in the dumb butt video, dumb butt syndrome. And we talked about how you can use your butt to propel you forward. Now, I can tell you, overwhelmingly, greater than 95% of people, I've never had someone overtrain their glute max, their big rump in the back there. It's very difficult to do that. If anything, it's undertrained. We need to have strong glutes. Guys, I've said it before, and I'll say it again. Your butt needs to be strong. Make your butt nice and big and firm, whatever. Forget everything society's ever told you, ladies. You want to have a strong butt. You don't want this flat thing that has no definition to it, has no ability to contract and to push yourself forward using your butt. So if this is confusing to you, I'm not going to get into the specific details. I encourage you to check out my video, Dumb Butt Syndrome, and it'll tell you a little bit more about how to fire your glutes correctly and relates that into gait function as well, walking. And also another one I would highly encourage you to check out is maintaining hip extension. That's another critical thing as we age, that we're able to get our leg behind us as we propel ourselves forward. Very important things for hip health, making sure that we are moving through the entirety of the range of motion and preserving that as we age. Which brings me to my last point, is that, actually two more points. One of the last points is, when it's related to range of motion, you need to be doing things in your exercise, whether it's yoga, whether you're doing Pilates, or strength training, whatever it is, we need to be certain that you are working through the entirety of the range of motion of the joint. As we get older, we want to maintain our range of motion. So that doesn't mean do explosive huge motions all the time, but work through the entirety of the range of motion. So you're not just, runners, if they're working in what's called a sagittal plane where they're just going straight forward all the time, that's not good. You got to be doing side to side motions. You got to be doing twisting motions through the hips and the pelvis. We have to keep all that stuff mobile. Many videos I've done on this before, so check out other Working Body Wednesday videos if that's confusing to you as well. So that's the second to last point. The last point is make sure you are strengthening your core. Now that does not mean go out and do crunches. I don't want you to go out and do crunches. That's not a functional exercise. It's rarely ever needed. Instead, work on your breathing to help you strengthen your core. Look at things like how you're expanding and then you're shrink wrapping around your center and doing exercise that way. So we're locking the rib cage out to the pelvis so they are one unit with each other. And then there's a million exercises you can do from there in terms of strengthening your core. But your lower abdominals and your obliques play a large role in the stability of your hip. So those have to be strong, and those also, as I've said before, have to be assessed on an individual level. So tell me a little bit more about what's been going on with your hips. What's helped you? Have you done yoga? Have you done Pilates? Have you done some other type of stretching or strengthening routine? Really love your feedback. Thanks so much. I know I don't always get back to you guys right away. Sometimes it's a couple weeks. So, if you've been commenting on these videos and you're like, why isn't Chris responding to them? Make sure you check back in a couple weeks. Sometimes I'm just a little too swamped to get to them right away. So I think I'm all caught up on comments as of this video. I think I'm behind maybe like 7 days. But definitely leave a comment. Tell me your story. Tell me more about you. What's been going on with your hips, and have you made it better? Have you had to have a hip replacement? And what was that journey like for you? Tell me a little more about that, because I learned so much from you guys, and I'm so thankful for you. I know that the people that are here watching these videos on the Thursdays, even if you're quiet, I know you're out there, and I know you're soaking some of this in, or hopefully a lot of it in. These are the serious learners, because we're getting deep into the body here and how it functions. So, hey guys, thanks so much for joining me. I will be back tomorrow with a TGIF video, the Talking Gut Immuno Friday series, where we talk about gut health and sinus health. And then I will be back next week as well. Next we will be moving up. Actually, we're going to take a pit stop at the sacrum here and do a little special section for that, and then we're going to work our way up into the low back for Learn Your Body Thursdays. So that's the plan. Thanks so much for joining me, guys. Make sure to subscribe if you haven't already. Hit the little bell so you get all the notifications for the videos, so you're not missing these helpful tidbits. And share it with a friend if they're having problems with their hips or other parts of their body as well. Have them join in on the journey with you. Thanks for joining me, guys, and I look forward to seeing you next Thursday or tomorrow on tomorrow's video. Have a great one.